So these are the DCM-like phenotype which are also to be excluded when we are diagnosing a patient with a DCM. But a final goal of treatment is to reduce the LV thinning or LV dilatation, improve the LV systolic function, maintain a normal longitudinal strain, and screening for fibrosis, which will identify patients who are at risk for sudden cardiac death and treat them with the ICD, and screen the first degree relatives for a possible genetic abnormality causing dilated cardiomyopathy. So we'll see about each of the parameters in brief. This is the speckle tracking which we saw earlier. So this is the speckle in the myocardium which continuously moves in and out during the systole. So this is a global strain which is represented in a bullseye fashion. So apex, anterior wall, septum, lateral wall and the inferior wall. So each region the strain is calculated and we give average as a global longitudinal strain. There are multiple strains. This is the most indicative of the prognosis, while radial or circumferential strains are not very indicative. You can see the different directions, the longitudinal up and down, mid wall side to side, circumferential is circular fashion. So three different speckle tracking by echo. This is a speckle tracking comparison between this patient is an endurance trainer with the dilated heart, that is the athlete's heart, where the LV is dilated, and here this patient has a dilated cardiomyopathy. You can see the difference in the speckle tracking. So this is the amount of excursion during systole towards the diastole. So the value, the maximal or the average is around -16. So this much of movement during a systole diastole period. While this is a dilated cardiomyopathy, the dilation is not as much as this patient, but the speckle tracking has shown a global longitudinal strain of only -8. So the excursion should have been here, but there is reduced excursion, that is acceleration and deceleration during the cardiac cycle. So here it is -7, while here it is around -16. So this is the athlete's heart, while this is a dilated cardiomyopathy. This is showing a significant dilated LA and LV with thinning of the posterior wall and the interventricular septum. There is significant mitral regurgitation because of the tethering of both the leaflets. So these are the candidates who are, in addition to guideline directed medical therapy, who are candidates for an annuloplasty or a mitra clip, which is a transcutaneous procedure. So this is a mitra clip, that is tear, end-to-end repair of the mitral valve, which can reduce the MR and the amount of adverse remodeling because of the mitral regurgitation related increased preload. MRI, so there are multiple parameters. MRI is better to assess volume, mass and thickness. So apart from this, MRI can be used. Native T1 time mapping can find if there is a adverse remodeling despite the absence of late gadolinium enhancement. So this is without contrast. T1 mapping time there prolonged means there is some amount of myocardial edema. So there is a myocarditis like picture. So those are the substates for reverse remodeling with medical therapy. Second one is the extracellular volume. So increased extracellular volume, these are the inbuilt software which can identify the increase in the extracellular volume and the distribution. Third, late gadolinium enhancement, presence or absence and the pattern of late gadolinium enhancement or burden. We'll see examples of each of this. So we can see the native T1, this plain MRI without any contrast. You can see the native longitudinal view and a short axis view of the LV and the RV. There is not much of involvement of the RV, but the RA is dilated, LA looks a normal size, while the septum thickness is maintained, LV is normal elliptical. While in T1, this is not the native T1, a late gadolinium enhancement, is showing scar involving the mid interventricular septum or the distal apical interventricular septum, while here you can see the late gadolinium enhancement scar here, the white pattern here. This is a mid-wall late gadolinium enhancement which is suggestive of myocarditis or the inflammatory cardiomyopathy. Here also we can see this is a T2 image showing the same scattered fibrosis in the mid-ventricular septum, the white one here in the mid-wall, suggestive of myocarditis as a reason for cardiomyopathy.